So a cancer diagnosis is disturbing at any age, especially so when the patient is a child. According to the World Health Organization, approximately 400,000 children and adolescents are diagnosed with cancer. The most common types of childhood cancer include leukemias, brain cancers, lymphomas, and solid tumors. Pediatric oncology is a medical specialty focused on the care of children with cancer. It's important to know that this expertise exists and that there are effective treatments for many childhood cancers. Clinical and radiation oncologist, NSIA Luth Cancer Center and founder, the Doctors Cancer Foundation, Dr. Adedayo Joseph, is in the studio with me to talk about pediatric cancer and every other kind or type of cancer. Good morning. Thank you for joining us on TVC Breakfast.
Thanks for having me.
You know, a lot of persons used to think that it's only adults that, go through the pains of cancer until recently when we began to see children develop all the types and kinds of cancer that we mentioned, lymphomatic, pediatric, whatever, leukemia, and all of it. And I am wondering, why do children develop cancer?
Okay, so, to begin with, it's actually not recent. Children have always had cancer. It's just that now there's more awareness and we're talking about it more. And there isn't an answer as to why children develop cancer. And that's a question that's important for me to answer because I get asked by parents all the time, is this something that I did or something that I didn't do? And I'm sure pediatric oncologists, which I'm not a pediatric, I'm a radiation oncologist, but pediatric oncologists, this is a question they have to address all the time. There's a lot of guilt with parents who think that it's something that they did, but it doesn't work that way. It's an aberration, and these systems that should prevent it from proliferating, they fail to work. And it's not caused by anything. Children haven't been exposed to anything long enough. So in a few cases, there are genetic syndromes that predispose a child to having cancer. But most of the time, that's not going to be the cause. That's not going to be the case. And unfortunately, you simply have to tell them it's just something that went wrong and it wasn't anything that they caused.
Very important. You talked about systems that are supposed to work that aren't working. Could you expatiate on that?
In the human body, cells are dividing constantly. At some point, there will be... So the way I explain it in clinic is to tell people that if you have an assembly line and you're putting out sliced bread and you're putting them out at 1 inch per slice, eventually there will be one slice that isn't the perfect 1 inch.
Yeah.
But then you have some camera in place that will pick out that abnormal slice and prevent it from going out into the market. And we have those kind of systems in the human body as well that detect when a cell is abnormal and force it to die or prevent it from proliferating. But what then happens in a cancer is that those systems fail to function and that cell sort of escapes, in quotes, escapes into the system and then it's able to proliferate itself.
All right, let's bring it back home now and talk to us about when we look at the various kinds of cancer, which is the most common? Is it pediatric? Because that is our focus actually for today, and talk to us especially about perhaps there are signs parents should look out for, or how do parents even know that this is what is wrong with their children? So
cancer is a lot more common in adults than in children. You wouldn't say that cancer is common in children. Infections are more common in children. Bruises, falls are more common in children. So we don't want parents looking at their child and thinking, oh, maybe he has cancer. Nobody wants to think that. And nobody wants to say cancer and child in the same sentence, really. So it's not really a function of telling parents what to look out for. What I think is more important is healthcare professionals knowing what to look out for. Because what we found in the time that we've been doing this work is that most of the time, the child does get to see a healthcare professional or who they consider to be a healthcare professional.
But they are not
then they're treated for malaria and typhoid, and then malaria and then typhoid, and then malaria and typhoid together again. And that goes on for a long time, and that delays the actual diagnosis, which is what causes a poor prognosis. So it is more important for the healthcare professionals to have an index of suspicion and to take a second look and not assume that everything is the common things.
So if for a parent now, because it's also important for a parent to be aware, to know that, okay, after a number of times that I've treated my child for perhaps malaria, typhoid, I should begin to ask, health professionals to do this kind of test. Now,
I think
how frequent how many times would you say, okay, after this number of time, a parent should say, no, I think my child should do this test?
I think every time a child is not well, they should see a pediatrician. So not necessarily a general practitioner, a GP who sees everybody. They should see a pediatrician who is a specialist at taking care of children. But we don't have them everywhere. I know we don't, but unfortunately, as a parent, you have to find one. That's what it is. So even though I'm a healthcare professional myself, every time my child is sick, I seek out a pediatrician to take care of her because that's not my area of specialty. And I can't expect somebody who doesn't do that every single day to automatically know what to look for or to know what to find. I think what is important for a parent is to make sure that it is a specialist that is attending to their child. And if you happen to see someone who is not a specialist the first time and the problem hasn't been resolved, then the second time you should see a specialist. You should ask for a referral. Ask the doctor to send you to a pediatrician, a consultant pediatrician. I think that's what's important.
Now, talking about it like we spoke earlier, is quite frightening. No one wants to see a child and cancer in the same sentence. Actually, it's really heartbreaking. But when we look at it, the challenge itself, how far have we come with really addressing this issue as a country?
There's been a lot of progress. When the National Cancer Control Plan was released a couple of years ago, there was no mention of pediatric cancers in that plan. And of course, that was very heartbreaking for anybody who worked in the space to see that the children had been forgotten. But I remember that what I said to everyone who had that conversation to me at that time was that it's our fault. I don't expect a policymaker to know what the problems are.
Right.
It is my job to inform him. It's my job to let them know. And that's why we have to advocate. That's why advocacy is important. If you go to the to developed countries, there are organizations whose full-time job is lobbying to raise issues, lobbying to bring issues to the attention of the policymakers. We assume that they know. We expect them to know. But how? I wouldn't know if I wasn't working in that space.
Absolutely.
So it is my job to inform the people who are not in my space. And so between then and now, a lot of progress has been made, and there's a lot of attention on pediatric cancers now. And I think that in the next couple of years, the pediatric cancer landscape is going to change dramatically. We still have quite a lot of work to do. I am, because I see the amount of attention and effort that is going into it, and I know that it won't stay the same.
Private sector or the government now?
Both. The National Cancer Control Committee now has a committee dedicated to pediatric cancers. And they're doing a lot of, the last meeting that we had, there was a lot of talk about pediatric cancer. You can see the attention of the government on pediatric cancers, and you can see the private sector getting involved as well. And you can see the social sector doing a lot of work. So I know that things are going to change. If
we say that they are doing a lot of work in the aspect of treatment, according to a report that I got from your organization, they're saying that there are no pediatric radiation oncology treatment center in Nigeria.
There isn't any cancer center in Nigeria.
A lot of work is being done in this aspect?
So a lot of work is being done now. And the reason that work is being done now is because we are bringing it to the attention of the people that need to do the work. If 5 years ago, there was no cancer center that is dedicated to children, but nobody was talking about it. So nobody was going to sit down to think, okay, how do we solve this problem? Now we are talking about it. Now I've had conversations with two different groups of people who have said, okay, how do we set up a cancer center for children? So that's what I mean when I say work is being done. It's not going to happen overnight. Right. And it's not going to shoot into the sky out of nothing. But the groundwork is being done. The conversations are taking place. And it is true, there is no cancer center in Nigeria that is dedicated to children. In a population of 200 million people, of which 40% of our population is children. We don't have a pediatric radiation training program in the country. And so these are things that need to change as we go forward. But they have started to change. The change is coming.
The change is coming. Because, I'm just wondering if we are saying that we are doing a lot of work and we still don't have all of this. Well, let me hope that that change you say is coming, because how then do we address parents who find their children in this kind of situation? What is the treatment option if we don't have that for them?
I'm somebody who likes to focus on what needs to be done. So when I started in this space, I spent a lot of time talking about the problems. And I do remember the first time I presented at the National Cancer Control meeting, I talked about all the problems, all the challenges, all the things that were lacking. And when I finished, one of the policymakers asked me, so what do we do? I didn't present any solutions. I just talked about them. I just came and complained and grumbled, but I didn't present any solutions. So now I focus on the solutions. We are going to set up a cancer center. The Doctors Cancer Foundation this month, we're holding the pilot of a pediatric radiation training camp. It's a virtual training camp. And the ultimate goal is to turn it into a virtual fellowship, so that you don't have to travel out of the country to be able to deliver radiation therapy treatments to children who have cancer. And that's where we're going with that program. We're going to hold the first one in a few days. And after that, we're going to scale it up. So when I say that work is being done, it is to say that we have identified the solutions that need to take place, and we're taking the steps towards them. That's not to say that the problems aren't real and present. Right now, any parent whose child has cancer is going to go into debts to the tune of millions of naira, because treatment is fully out of pocket. It's not funded or covered by anyone or any insurance scheme. And you're looking at very expensive treatments. They have to travel across state lines to get access to any kind of specialist, pediatric oncologist or radiation oncologist. So the problems are there, they are existing, and they're real. But we want to talk about the solutions. We want to talk about what needs to be done and what is being done to solve them.
Okay, so let's talk about the solutions. You just mentioned an event. I want you to, shed more light on the event that is coming up on the 29th and 30th of this month. Perhaps who should attend and all of it.
Well, the event is PEDROC.
Okay.
It's, that's the acronym, but it's Pediatric Radiation Oncology Bootcamp. And like I said, it's a virtual training program for healthcare professionals. It's targeted mainly to radiation oncologists, because what we're trying to teach is how to be able to treat children with radiation therapy. But anyone who works in radiation oncology, that includes radiation therapy technicians, medical physicists, nursing oncologists, surgeons, pediatricians, anyone who works with children is invited, because this knowledge is for all of us. It's important. The pediatric oncologist also needs to know when radiation is needed, so that he can refer the child for radiation. And he needs to know the radiation that he wants the child to receive. So everyone who works in the pediatric cancer space is invited. And like I said, it's a pilot. This is the first one. At this time, we have an audience. We're expecting an audience of about 200 people. We have experts from all over the world coming to teach, take the sessions. And ultimately, we're trying to make it into a virtual fellowship where we can then produce pediatric radiation experts in the country without anyone having to set foot outside of the country. That's where we're going. And then when we have those people, they will then train. So we're training the trainers who will then train
others. Very, very important.
Exactly.
But then that is one solution on the one hand. What are the solutions? Because you said we're talking about solutions. We've spoken about one. What other solutions are there for perhaps parents who find themselves? How much of engagement are we still having with policymakers even at this point, stemming from what is coming up now? How much of engagement are we going to be having with policymakers to ensure that whatever we're coming up with is pushed forward and we can have the benefit across the country?
Again, I mean, these things, yes, what we have now are baby steps, but we're moving in the right direction. So if I use the center where I work, for example, the NSI Youth Cancer Center, children pay 50% of the cost of radiation. Every child that comes into the center only pays half of the cost of treatment.
Why?
For radiation treatment. Because they're children. Okay. So the center offers a 50% discount to children because of the advocacy that we have done to highlight the challenges that these people go through. So that's one step in the right direction. The Doctors Cancer Foundation has a program called the Pediatric Cancer Access Program, where funders and donors pay directly to healthcare providers. Right. So they pay to the hospital, they pay to the pharmaceutical company, they pay to the surgeon, they pay to the treatment center. They're not giving them money to the foundation. So the money is in the bank, and then that child comes in and they never get a bill. The child is treated from the beginning to the end, completely at no cost.
That's a lot of work. Well done. So
like I said, baby steps, but we're moving in the right direction. Ultimately, what is going to happen with PCAP is that it's going to become policy. Children are not going to have to pay to be treated for cancer. That PCAP will be funded by companies all over the country. Every company will be required to give 1% or 2% of their annual profits to pediatric cancer treatment. It will be supported by the government, and so every child can be enrolled. And
state governments are in agreement with this, and these companies. No, we are
advocating.
I just want to know, because I am like the audience there who might be watching and want to know. Okay, because this is a lot of hope being brought forward for a lot of parents, and we don't want to dash that hope. where they begin to look for these things at the end of the day, and they find out that what we're talking about was really not, well, like you said, baby steps, but then hopes have risen. State governments, at what level are we now? Are we saying that all of the state governors, the 36 states of the Federation and perhaps the Federal Capital Territory have keyed into this vision, and businesses, we have engaged them such that they are also agreeing to give out 1 to 2% of their earnings to this?
We are in the advocacy stage, so we're still talking to them. But this is what I have found. The people who make decisions are people. They're human beings. And like I said at the beginning, I have found that nobody wants to hear the word child and cancer in the same sentence.
Absolutely.
When you present to them what the issues are, it is very, very uncommon that they don't want to help. The important thing is for us to be able to get in the room and tell them what the issues are and tell them what the solutions are, how they can key into the solutions.
Very, very, very important. Now, one more question that I would like to ask is the aspect of nutrition. Parents ensuring that as we move forward, because this also is a part of creating enlightenment for parents, not just awareness, advocacy, or even talking about the program coming up. What can parents do in the aspect of nutrition? We've had all sorts of stories. If you read up, if a person has cancer, you avoid certain foods and this and that. Does that also apply when we're talking about children who have cancers?
I'm going to say this, and I really want to say this because this is a question I get asked by every single patient that I treat. And I had a gentleman in the clinic with me yesterday, and this is how I explained it to him. I told him, if you drink water only for the next 30 days, only water, your tumor will continue to grow because it will take all the nutrition that it needs, regardless of whether you feed yourself or not. So it doesn't need you, the cancer doesn't need you to eat anything. It will take the nutrition that it's a parasite. What you will starve is your healthy cells, your immune system. You will make yourself vulnerable, less likely to tolerate treatment, less healthy. Now, having said that, that's not to say that you should then run out and then feed yourself with processed foods and unhealthy things and all of that. And so I told him he should go back to the balanced diet that we were taught when we were in primary school. A healthy balance of carbohydrates, protein, healthy fats, fruits, vegetables. This is what everybody who is going through treatment should have. There is no evidence that cutting out carbohydrates entirely from your diet is going to help anything. If anything, from my experience and from my colleagues' experience, what we have seen is that those people tend to not do so well because they are nutritionally deficient. So you have to eat a healthy diet. You're not going to be stuffing yourself with sugar and processed foods and things that are unhealthy. But at the same time, cutting out an entire food group is not going to help.
Well, that's the fine place to leave the conversation this morning. Thank you so much. Clinical and radiation oncologist, NSIA.
Thanks for having me.
Cancer Center and founder of the Doctors Cancer Foundation, Dr. Adedayo Joseph. Thank you so much for coming.